Well, this will be the landing page that you'll come to when you do actually access the actual cost tool dashboard on our site. And the very top paragraph will just explain that we use the Medicare cost reports, and we're reporting 2011 through 2019, and we're including only 4,600 of the hospitals. It is the critical access hospitals and acute care hospitals. And then there'll be a little bit overview. You have 4 tabs that you can look at. You can compare among hospitals. You can view a single hospital, explore by state, or explore by health system. Now we'll be going through each one of these, so I won't take the time to read the description on each. But an added feature is that you can actually download the full data set that is backing up this dashboard. So by clicking here, you can pull up the Excel file that includes all the data elements that are behind this dashboard for 2011 through 2019 for the 4,600 hospitals. So you could do your own analysis and your own research. Now, the actual tool itself, the work with Rice University, we got over 150 actual data metrics calculated, but we chose about 60 that are the most critical we felt for states, and those 60 will be in this actual data set. You can also click here and you'll be able to get a list of definitions of all the key metrics and variables that are used in this tool. You'll be able to get a definition of what each means. So to start off with, I'm going to go to Explore by State. So you click on this tab, and the directions are here. You click on each input box. Oh, I should have scrolled. Okay. Each tab will have input boxes at the top. And in this particular case, to look at state, you have to pick a year. It's required. And then you have to pick a state. Now you can pick more than one states, and we will do that in a bit so that you can do some comparative. Let's move down. The first thing that we show, so I'm looking at Indiana because we've been doing some work there with that group. So we're a little familiar with the tool in Indiana. But if you look at Indiana, the first item that we come up with is the median net patient revenue per adjusted patient discharge for Indiana. An adjusted patient discharge is the calculated amount that we use that is a standard metric to be able to come up with the amount of inpatient and outpatient care. So we look at the number of patients. Now you can hover over any point, for instance, 2017, and you'll see that the median net patient revenue was $10,429 for Indiana, and that was comprised of 120 hospitals. And again, you can go over each one. Now, this graph will populate for the full period. You'll get a trend line here. To get to the deeper detail, we've got bar charts. And since I chose 2019, this is the data for 2019. For all, you'll see the median for 2019, and that will tie to this, the 11,323. But you'll see the distribution across bed size. And probably not surprising, you would see the lower in the 0 to 25 category. We split the hospitals this way: 26 to 100 bed size, 101 to 250, and 251 plus. And you'll see the larger is in the larger hospitals, and that median net patient revenue per adjusted patient count is over 15,000. We also take a look at it by hospital ownership, and we have split ownership into for-profit, governmental, and nonprofit. Again, the all will tell you the same amount that you saw above, and then you can see the distribution across the ownership. We then take the next step. Let's look at operating costs, hospital operating costs, and you'll see the same. For 2019, the median cost is $8,549. That is comprised of 119 hospitals. You might see some variations in numbers, and you'll see at the footnote at the bottom. If data was missing, then we merely put a period in the slot and it will read as a zero, as a non-existing value. Or in some cases, when we did calculations, there were outliers. We worked with Rice University under standard statistical methods to remove outliers. So we may see a bit of a variance there. Again, we break it down deeper into, let's take a look at the bed size. And again, this is the operating cost per discharge. And in this case, it does follow the same as you saw revenue. And we break it down also by hospital ownership. The next step is to net those two. What is the operating profit loss per adjusted discharge? And again, this is the median of the operating profits. We come to 2,504 per adjusted discharge is the median for Indiana. But take a look at when you break it down by bed size. For bed sizes 0 to 25 in Indiana in 2019, there's 39 hospitals. The median is 604. But jump up to here. For 2019, for the larger hospitals, 251 plus bed size, the median is 4,626 with 16 hospitals. So we wanted to show the trend because that tells you one story, but you have to dig deeper to see where that trend or where that spread is. And probably not surprising over here, government comes in lowest, 21 hospitals, 2,000, the for-profits higher, and the not-for-profits in the middle. Now we jump away from the per adjusted discharge and we move into the hospital's overall performance. What is the bottom line? What is the net profit margin reported by this hospital? We saw a dip in 2018, and that actually came when we dug further from accounting entry done by IU Health, but it's such a large hospital that it had that impact. And then we see in 2019, the median is a 7.2% profit margin. Again, breaking it down, the smaller, it's 1.6% for your critical access hospitals, your 0 to 25 beds. We move on up, you can see it gradually going up to 11.8% net profit margin for bed size in 101 to 250. And then the largest is a 16.5%. And breaking it down again by government, for-profit, nonprofit. So now we jump to the bottom line. One of the things we look at is cost to charge ratio. And as you know, that is charges divided by, excuse me, it is the right here. It's the two components, the charges and the hospital operating costs. So we have consistently seen cost to charge ratios dropping. And we'll talk about that a little bit more when we look at individual hospitals, but the median for Indiana is 25%. Again, breaking it down, we see the different graph here, which isn't surprising. The critical access hospitals often have the highest cost to charge ratio, and then it will slowly decrease down to 22% median for the larger hospitals. Government hospitals, a higher 30%. And as we move into break even, now break even is the point at which the hospital revenue, what a commercial payer would have to pay a hospital to allow that hospital to break even, meaning the total revenues it received would equal the total expenses for that hospital. Now, the commercial break even, we assume, would cover any shortfall in government programs. It would cover charity care, bad debt, Medicare Advantage shortfall, and the other covered expenses, the hospital expenses. So this is not surprising for us. Indiana ends up a median 161%. We can also benchmark with national, we can benchmark with other states, and we can benchmark by bed size, but we're finding that somewhere between 150, 170 is kind of coming out as that benchmark. Again, breaking it down, the larger hospitals, the benchmark, or the median is 147%. Slightly higher for these two categories too. Break even is an interesting measure because when you dig in deeper, you do some analysis, you can also see that it might in some ways help you look towards efficiency, how well can the hospital perform at that level of reimbursement. Down here are the footnotes, which are on every page, and they will explain in the downloadable data. This symbol of a period means missing data, and the text of 99999 denotes invalid data. Also, you will find that in a number of cases, a small number of hospitals, there'll be 2 Medicare reports for 1 year. That usually happens if there's a merger, acquisition, or a change in status of the hospital. And in those cases, for this first rollout, what we have done is included the report that has the most months. Now I'm going to switch a little bit. I'm going to go back up to the top. And I'm still learning to maneuver this. I'm going to go back up to the top, and I want to compare Indiana. I want to compare Indiana to Michigan because there's been a lot of looking at those two states. And I want to see how this data lines up with what other studies have seen. So you pick the 2 states and you update the filter. And here is an interesting picture. Here, the blue is Indiana. We follow the same trend line we saw before, but Michigan is running a little bit lower. With 131 hospitals, the median net patient revenue per adjusted discharge is slightly over $10,000. Comparing the hospitals is interesting because we look at the median revenue comparing the 2 states. And you see Indiana's a little lower in this 0 to 25 category, but much higher in the 251. We do the same with the operating costs, which paralleled pretty closely. Again, Indiana appeared to have the higher costs in the larger hospitals. But here we look at the profitability. Now, you can't get to this point by taking what the graph shows as net patient revenue minus the operating cost per adjusted discharge. This is the median of the operating costs reported. Now, this didn't surprise us. Indiana is coming in higher at the 2,504, which you saw on the other chart, compared to the 1,500 for Michigan. But it's interesting to look at where this is coming from. It's the larger hospitals mainly, for the size, but that is 16 hospitals, 4,626 is the median, compared to 2,435 in Michigan with 33 hospitals. Over here, the 26-bed hospitals, 33 of them in Indiana, compared to the 36 in Michigan. And I'm going to go through this a little bit quicker because I think you understand the basis of all these graphs, and the purpose now is to look at comparisons. And we also have a national trend line we could put in too. Same here on the net profit. This is the bottom line comparing the 2 states. You can see that the Indiana hospitals do show a higher profit margin. That's net profit. Going to the bottom line, Michigan is operating with a little bit higher cost to charge ratio at 33 compared to 25. Again, to be, if you want more detail, you can do it by ownership and by bed size. Now, on commercial break-even is interesting. Indiana's break-even is higher, and you'd want to do a little bit more work, but overall, you can assume that probably their costs are a little bit higher, but you also want to look at their losses on government programs and a few other factors. The commercial break-even appears to be higher for Indiana for all hospitals and all ownership types. So let's jump over and let's compare hospitals. And at this time, I had pre-populated this. we're going to look at 2019 for Indiana, and we're going to look at their nonprofit hospitals that were 251 plus bed size, because we saw those bar graphs kind of jump out there. So let's take a look at what that data will show us. This first graph will show you the specific hospitals, and this is the number of discharges. IU Health, definitely the largest at over 92,000. You can see the other hospitals ranging. You can see the number of discharges. Then we get into what you saw before. When we start talking on the compare hospitals, the chart will look at the United States for any hospitals that fit those that criteria I picked, which was not for profit and the plus 251 beds. You can see the range that you're going to have for net patient revenue. And you can just quickly look at how many hospitals fit that quality. Now in Montana, we have 3 hospitals. Wyoming doesn't have any hospitals over that size that fit that size category, but you can start looking at the states. We look at the detail now for these specific hospitals I wanted to look at for the net patient revenue per adjusted discharge. We can look down now, let's look at the costs. Again, you'll have this map that you can scan over and look at the states and look at the numbers to do some more comparison. Here we have Indiana, 14 hospitals, the median of those 14 hospitals for the costs. And one thing I like is under each chart, whenever you enter costs, you'll first have the map. Then you'll have for the hospitals you specifically selected the operating costs in this category. And then we will recap here the median for national and the median for Indiana and the number of hospitals included. Getting down to operating profit. Here we are with IU Health. This is 10,000 per adjusted on to St. Vincent's. You can look at the specific hospital. And it was interesting because you can look at now compared to the national median, Indiana is higher. Down to net profit margin again, this is the bottom line as reported by the hospital. You see that the metric which we saw before when we were looking at Indiana for this size of hospital is 16.6% is the median, whereas the national for hospitals of that bed size is 7.1. We look at charity care costs as a percent of patient revenue, and this is cost. This is not ChargeMaster or Loud or anything. It is the actual cost. You can get a feel for how much of that revenue the hospital turns around and uses for charity care, and it's the percentage of net patient revenue. Again, compare it to national. And then we also do include uninsured and bad debt. This is uncompensated care. What was the hospital, what did it use up in resources to be able to provide care for patients that did not pay? And we usually find this between 1 and 2%. Here's the median, national median 0.9. We're finding Indiana at 1.1. Cost to charge ratio, you were able to get this by specific hospital. Commercial break even. This is interesting. You'll see, and we've done a lot more work on Parkview, which is a very high cost hospital. You'll see the break even would be 305% of Medicare. And then you jump to St. Vincent's at 225. We put a dotted line for 100% of Medicare. You can see that IU Health actually comes in at 106%. The next thing we do is we compare that break-even point. As Maureen had mentioned, break-even is a critical measure to use against what you are paying. We're using the RAND 3.0 data, which is a blend of 2016 to 2018 data. And here you're able to see that Parkview, their calculated break-even is 305%. And the price that RAND has determined from the sampling they had is 452%. We worked with RAND to make sure we were comparing apples to apples, because the typical RAND pricing includes the physicians, and we were able to work with them to get the exact calculation to match. So this is inpatient, outpatient care only, and you can compare by hospitals. So let's take a look at a specific hospital. And we're going to continue along our trend of looking at what in Indiana. So we're going to view a single hospital. And for this case, I have Montana internet, you guys, I'm sorry. There's Indiana. And I have to get this down just a little bit so I can add the filter. And then I'll scroll back up. And the hospital that I am going to do on this particular one it's an Ascension hospital, because we're going to look at Ascension as a system, because that is an area, another tool that the metric can look at. So I'm going to scroll down to St. Vincent. I always need it. Where am I here? Right here, Indianapolis. It's St. Francis. I apologize. Let's try, not the hard type. Let's try this one. Now, it will take a while, usually, even if you had high-speed internet, because this is a large data set that the tool is accessing. But one of the areas that accesses fairly quickly, this is the operating profit loss per adjusted discharge over time. And you can see the top charts would show you the net patient revenue per adjusted discharge and the hospital operating cost per adjusted discharge. This is what you'll see over time. You can also bring in the net profit margin. Ascension is at 18% in 2019. I think the low here has been 14%, and the highest point was 23%. This is bottom line profit. We also moved in here to take a look at this hospital's percentage of charity care cost and the percentage of uninsured and bad debt as net patient revenue over time. You can see that it's 0.39%, so about 0.5% it has dropped to for uninsured and bad debt, and charity care is 3%. It's been interesting looking at this particular graph for hospitals. I've been looking at it in Montana for when Medicaid expansion came in. And as expected, you will see declines in these particular measures. But then we look at payer mix. And this is dependent upon the year that you put in the screen at top, and I did 2019. You could choose prior years. And this first chart will tell you the payer mix. And this is not by revenue. This is by patient services, and it's basically the standard measure is off of charges. So we see that 39% of their payer mix is commercial. If we get into these smaller, you see charity care is 3%. Uninsured and bad debt is 1%. Medicare Advantage, Medicare itself, and Medicaid. We then look at what was the profit margin. This is the operating profit margin by payer type for that particular year. Now in commercial, it was 39% of their population, and the profit margin was 62%. We get to Medicaid, and it's a different story. Medicaid profit margin, they lost 40% on Medicaid. But you have to keep in mind the payer mix. It's about 20% of their payer mix. On Medicare, they're showing a 4% profit margin on Medicare and Medicare Advantage. So we do a metric that's called payer mix adjusted profit loss, where we calculate really multiply these by each other to say, what is the relative value? So the 40% that you lost on 20% of the business does have an impact, a relative impact of -5%. So, or -8, excuse me. So it kind of helps you get a little bit better picture of that. This particular graph I like. As we talked before on the cost to charge ratio, we have seen cost to charge ratios really declining, but is that because charges have increased or is it because costs have decreased? So we break it apart into this graph to show you what have hospital operating costs done over time. They've gone from 624 million up to 840. But what have charges done over that time? From 2.5 million on up to 4 million. The interesting part of this chart is to really get a feel for what's happening with charges versus costs. And for the networks, the insurance company networks that are still pricing as a discount off ChargeMaster, I think that this is a really good chart to take a look at. We move down to break even. And here you can see that the trend for the break even for this particular hospital is down at 142%, 151. But something kind of interesting, we're finding in most cases, the break even point doesn't really fluctuate all that much, except in years that there might be an anomaly in an expense or a merger or acquisition, but it has stayed fairly relative. We do post the RAND price here. The RAND price from St. Vincent Hospital is 357%. So now I want to skip over to Explore by Health System. Because this particular hospital is with Ascension Health, and we know Ascension is in a lot of states, we wanted to kind of see what that would look like from the system perspective. So we look first at, now this is the total number of discharges. So these are the total number of patient-adjusted discharges. So this is going to include inpatient and outpatient. So basically the number of patients. And we see that Indiana isn't the highest, 183, 188, but you have Michigan, much higher at 287, Wisconsin, a neighbor, and you have a few other states that they operate in. But I want you to keep focus on Indiana because they're kind of a little bit above the middle of the pack here. But if we scroll down to the operating profit or loss per state, Indiana's the highest at 923 million. So it doesn't have the most discharges, but it does have the most profit. We compare it to Wisconsin and Michigan, the other two states I looked at. So this would help the user kind of frame up. I need to dig a little bit more. I need to go back and look at the Ascension hospitals in each of these, which you can do with the tool and kind of come up with your own measures. Now that is a brief overview. I've gone it through it very, very quickly, but it is a summary of what the initial rollout of the tool will include.